Hello, everyone. Thank you for joining me for the Provider Stabilization Fund application overview. My name is Tracy Gonzalez with the Department of Healthcare Policy and Financing, and I'll be going over the process of filling out the application for the Provider Stabilization Fund. We will be using a Google site for the providers. The Google site includes the provider application, the attestation form for the provider care for the primary care fund grant recipients, and the provider folders. Access to the folders will be granted to the primary and secondary contacts listed on the intent to apply. Your application and supporting documentation, once you have completed it, will be uploaded to your provider folder. If you are having issues accessing your provider folder or you have not received an invitation to your provider folder, please reach out to us and let us know. Also, if you have any other individuals that need to be included in the access for your provider folders, again, reach out to the Provider Stabilization Fund inbox and we can go ahead and grant them access. Once you have clicked on the application from the Google site, you will want to download it to your desktop so that you can begin working on it there. It is a read-only file, so you will need to download it to your desktop in order to fill it out. The application is in an Excel format. Please leave it in an Excel format. Do not try to download it to a PDF or any other platform other than an Excel. The application consists of numerous tabs. The first 5 tabs in the application are more for information. They include the table of contents, the introduction to the Provider Stabilization Fund, definitions, the Provider Stabilization Fund timeline, and instructions on filling out the application. The 6th tab that you will come across is your agency information tab. In this tab, you will list the legal name of your agency, your federal employer identification number, your address, and the names of your primary and secondary points of contact. Then up in the upper right-hand corner, you will check the box that best describes the type of provider that you are. Those choices are comprehensive behavioral health provider, rural health clinic, federally qualified health center, and health care provider. There is a link right above where it says check the appropriate box based on the definition in the definitions tab. If you click there, that will take you back to the definitions tab where you could read through all 4 of these definitions to make sure that you are checking the appropriate box. The next set of boxes is as to whether or not you are a current primary care fund grant recipient. Now, primary care fund grant recipients, if they choose to claim that 1% that fall in the gap between the 199 and 2% of those patients' federal poverty levels, they will need to fill out a new application, the Provider Stabilization application. They will also need to upload all of the required supporting documentation, and that also includes obtaining a new outside entity verification of their patient count numbers. The next tab is the applicant history tab. Here you will state your agency's mission and briefly state your agency's history of providing primary care or comprehensive behavioral health care services to low-income uninsured individuals. So you will list the specific services or care provided, how those services are provided, and the date your agency began providing services. Now the next tab is your unduplicated patient count tab. This is the methodology that is used to come up with your step 5 patients, or the step 5 is your low-income uninsured patients that are at or below 200% of the federal poverty level. I wanted just to give you a quick visual here before we jump into exactly how to fill out this chart. So we'll move on. We'll begin with your unduplicated patient count. Your unduplicated patient count is the sum of patients who have had at least one visit or encounter with an eligible safety net provider during the applicable calendar year, but does not include the same patient more than once. The sum shall be calculated on a specific point in time occurring between the end of the applicable calendar year and prior to the submission of the application. Each patient shall be counted once under only one payment source designation. The patient's payment source designation shall be the payment source designation listed for the patient at the specific point in time in which the calculation is made. The sum shall not include counting a patient more than once if the same patient returned for additional services during the applicable calendar year, counting a patient more than once if the payment source designation changed during the applicable calendar year, should not include individuals who have only received services through an outreach event, community education program, nurse hotline, or other type of community-based events or programs that were not documented on an individual basis, should not include individuals who have only received services from large-scale efforts such as mass immunization programs, screening programs, and health fairs. And it should not include individuals whose only contact with the provider was to receive special supplemental nutrition program for women, infants, and children counseling and vouchers. The definition of visit or encounter is an appointment with a medical personnel in which the patient received health-related services and/or products, and the appointment is customarily billable to a third-party payer. So during this definition of an unduplicated patient count, we mentioned the specific point in time that the calculation is made. This is called a freeze date. So the freeze date acts as a point in time in which the data is fixed and definite so that your unduplicated patient count can be made. You will be looking at the patient's visit closest to your freeze date as the source designation used in your application. So we are not looking for every patient's appointment, your patient's appointment throughout the entire year. You are looking at only the last appointment closest to the freeze date that you choose. That is going to be your source designation that you'll use in the application. The unduplicated patient counts should be calculated on a specific point in time occurring between the end of the applicable calendar year, which would be December 31st, 2024, and prior to the submission of the application. So when we say prior to the submission of the application, we are referring to the submission of the primary care fund application, which was May 23rd, 2025. We have chosen this date so that the primary care fund application and the provider stabilization applications will be aligned. So your freeze date can be anywhere between December 31st, 2024 to May 23rd, 2025. And again, we are looking at the patients for calendar year 2024 up until your freeze date. So your unduplicated patient count, as I mentioned, should be calculated on a specific time occurring between the end of the calendar year and prior to May 23rd. So again, your freeze date can be anywhere between December 31st, 2024 through May 23rd, 2025. The point in time acts as a freeze date so that your data is fixed and definite so that your count can be made. A patient can be included in only one of the payment source designations listed in the questions in the table that I showed you 2 slides back. And we will be moving on to that table in just a few moments. So when we say the payment source designation at the time of the visit, we're going to go through some examples using calendar year 2024 and those first few months of 2025 to illustrate how to determine the payment source designation for the patients. So in example one, the specific point in time in which the data was collected for the calculation or the freeze date was December 31st, 2024. So in this instance, this client or this clinic is going to be looking at the patient's visits from January 1st, 2024 through December 31st, 2024. And they will be looking at each patient's last visit closest to that December 31st date. So we'll take a look at patient A. Patient A was seen 3 times during the calendar year 2024. They were seen January 20th. They had Medicaid at that appointment as their payment source. They were seen again March 11th, at which point in time they were uninsured. And then they were seen again December 15th, 2024, and they had Medicaid. The December 15th appointment is closest to the December 31st freeze date. So therefore, that is the appointment you will be looking at. They will be looking at for their calculations. At that point in time, that patient had Medicaid. So Medicaid is going to be the payment source designation that they're going to use in their application response. So we'll move on to patient 2. Example 2, and this clinic has decided to use May 1st, 2025 as their freeze date. So in this case, this clinic will be looking at patients' visits from January 1st, 2024 through May 1st, 2025. And again, they will be looking at each patient's last visit closest to that freeze date. So in this case, patient B was seen again 3 times. They were seen January 10th, 2024 and July 18th, 2024, which at both of those appointments, they had a third-party payer. They were seen again April 25th, 2025, and they were uninsured. The April appointment is the appointment closest to that May 1st freeze date. And at that point in time, they were uninsured. So uninsured is going to be the payment source designation used in the application response. So let's take a look at the unduplicated patient count tab so we can kind of tie it all together. The first step on this tab is for you to enter your freeze date. So again, your freeze date can be anywhere between December 31st, 2024 up until May 23rd, 2025. Once you have decided on your freeze date, you will identify the total number of unduplicated patients served during that calendar year. Once you have your unduplicated patient count, you will begin to bucket your patients into the different categories. So you will begin with step 2A. You will enter the number of patients from your unduplicated patient count that have Medicaid, either primary or secondary. Step 2B is the amount of patients that have Medicare, either primary or secondary. Step 2C, the amount of patients that have CHP plus. Step 2D, the number of patients that had any other type of reimbursement for their healthcare costs by governmental programs such as Social Security or the Veterans Administration. And step 2E is any other third-party payer not mentioned above, such as private insurance. Step 3 is going to auto-calculate for you. Step 3 is your number of uninsured patients. Moving into step 4, of your uninsured patients that were captured in step 3, how many of those patients have family incomes that are above 200% of the federal poverty level? So this number should include the number of low-income and uninsured patients whose family incomes are 201% of the federal poverty guidelines and above. And then step 4B is how many of those patients out of step 3 where the FPL was unknown or undetermined. And then step 5 will auto calculate for you. Step 5 is going to be your low income, uninsured population whose incomes are at or below 200% of the federal poverty guidelines. So you will follow the steps in this table to calculate your step 5 patient. These again are your low income uninsured patients who are at or below 200% of the federal poverty guidelines. And this is the number your award was based on. And I want to remind you that step 3 and 5 auto calculate for you. And I do see a typo as I am giving this presentation. It is your low income uninsured patients who are at or below, and this says who are below. So I just want to point that out, and I apologize for that. So again, your step 5 patients are those patients that are at or below 200% of the federal poverty level and are uninsured. Moving on to the right of that is your source of data. Here you will list your main facilities and any satellite clinics that you have where you will be pooling your unduplicated patient count from. So please make sure that you list any of your satellite clinics that you will be pulling the numbers for your unduplicated patient count from. The next tab is the Billing Processes and Procedures tab. This is simply the sliding fee scale policy and procedures for your agency. If you are a free agency or an agency that does not charge, please state that you are free of charge agency and sliding fee scales will not be required, but please make sure that you do make a note of that on this tab. Those of you that do utilize the sliding fee scales, we will need at least 2 sliding fee scales uploaded to your provider folder. Please make sure that your sliding fee scales cover the duration of your application. So if you chose December 31st, 2024 as your freeze date, please make sure that your sliding fee scales cover from January 1st through December 31st of 2024. If you go beyond that, please make sure that your sliding fee scales cover those extra months. We will also need the corresponding copayments for each of the sliding fee scales. And again, those must be uploaded to your Google folder. The next tab is the Eligibility Screening tab. Does your agency screen for Medicaid and CHP Plus? If you answered yes, please describe your procedure for screening patients and referring them to the appropriate entity for eligibility determination. The next tab is the confirmation by applicant agency. This is just simply confirming that all the data submitted in the application response is true and accurate. The applicant agency confirmation form can be found on the provider Google site to download and sign. Once you do sign that, please upload the signed PDF to your provider folder. The next tab is the outside entity tab. The criteria for an outside entity are the business or professional shall not be classified as an employee of the applicant agency or HCPF and shall not have any direct or indirect financial interest with the applicant agency related to the provider stabilization funds. And the business or professional shall have auditing experience or experience working directly with Medicaid or similar services or healthcare programs for low-income uninsured population. Now, the outside entity must sample a minimum of 25 patients, verifying the patient's income level and that the sliding fee scale was appropriately applied. Now, let's look at the outside entity as a second set of eyes on your unduplicated patient count. We want to ensure that your patient count is accurate. So that is the reason we are asking for this outside entity piece. We have a few clinics that participate in the primary care fund that have experience with the outside entity process, and they have volunteered to give guidance to anyone who needs it. We know this may be a new requirement that a lot of clinics have not come across. So please reach out via the Provider Stabilization Fund inbox if you would like us to put you in contact with one of the primary care fund grant recipients that have offered to help you guys out. On this slide is a sample of an outside entity letter so that you can see what it entails. If you notice on that part 3 on the outside entity letter sample, you can see where they have verified the patient count numbers that the clinic has submitted with the application response. And that brings us to the end of the application. We have a few upcoming dates, or in this case, we have a past date, which was the intent to apply. That was due October 1st. The applications are due on the provider site in your provider folder on October 24th, 2025. We hope to get award letters out December 10th, and we are anticipating payments to go out by December 31st. I have included a few links that are very helpful. The Provider Stabilization Fund on the HCPF site has a lot of good information. There's a fact page on there. Also includes the link to the Provider Google site. On the Provider Google site, again, is the intent to apply for funding, which has passed, the attestation form for the primary care fund grant recipients, the Provider Stabilization Fund application, as well as those confirmation by an outside certification by an outside entity and the confirmation by an applicant agency. All of those can be found on your provider Google site as well as your provider folders. And as always, please feel free to reach out to us via the Provider Stabilization Fund inbox if you have any questions. We're very much looking forward to working with you all, and thank you very much for watching.